being a guy who come from the private sector, I may be a little bit dispassionate, more controversial, and raising hard questions. It actually would have been nice if the Minister of Health is here, because we're talking about funding the healthcare service, but he obviously has other engagement. One of the things I particularly said Magdi really keep challenging me about is he still used the phrase healthcare administrator, and I said to him, it have moved, they are called healthcare manager. And I really need to focus about management, because management of healthcare is a crucial issue. Okay. And if you're going to spend totally trillions of dollars, which the developed world spend on healthcare, you really need first-class managers. Otherwise, you will end in a mess. So a manager is a guy who takes an interactive role, as an opposite to administrator who just want to file the rules and make sure his cabinet is filed the right way, and therefore also what I call the filing cabinet syndrome. On top of that, we have another definition. It's what we call leadership management. And leadership management is very important, because these are the people who are creative, who really challenge the status quo. And when you are creative and thinking in different ways, trust me, your bound will go a little bit longer. Can I have the first slide, please? Right. There is 3 golden rules by which any healthcare in the world is judged as good or bad or indifferent. And that's accessibility. A good system must be accessible when and if the need arises, and also the cover of this accessibility should be wide and universal. Then we judge the quality, and we have all sorts of indicators to judge the quality of the delivery, either from clinician or from management performance or whatever. Then efficiency. Systems have to be efficient and fighting waste all the time, constantly, because we tend sometimes to forget that in any system in the world, not just healthcare, there's a great amount of waste. I bet we can't really eradicate it to 0, but if we can reduce it from 15 to 10 to 5, we're doing great. Can I have the next slide? No, got it. I haven't finished. Can you go back? Yeah. I put here something called value for money versus cost containment. For the last 2 decades, the phrase value for money became very popular, extremely popular, and a lot of speakers spoke about it. But you know, the truth is, and being controversial, we got stuck. And why we stuck? Because clinicians have their own definition to what constitutes value for money. Politicians have a different one. Managers have a third one. Therefore, really, there haven't been a broad, universal definition to what constitutes a value for money. So all the system now, or all the manager in the system, either government or professional manager, are grappling with the fact how to exercise cost control, to keep it down. Because trust me, if the spending in the healthcare keep escalating as it is doing, there will come a time the system will bankrupt. All right, now I'm going to inject a little bit of dose of healthy cynicism into the system. Can you imagine the healthcare system like an onion? And we try to peel different layers of the onion. So what are the different layers which covering the onion, which have the public in the heart of it? Because there is this great sentimentality about healthcare, which is correct, and it should be. But in the same time, there is other realities. So if we remove the vested interest, either from clinician, manager, politician, or whatever it is, and particularly with politician, I mean, every general election in the United Kingdom, the two parties have this phrase, healthcare is safe in our hands. And I never understood really how it could be with two different politicians is safe. Then we remove the political rhetoric, we remove the emotional and sentimentality, and we sidestep the dependency culture, and that's a message for me to shut up. What the voter will say, okay? Can I just go to... If you ask the voter to pay more tax to fund the system and to pay more money, when they go to the voting booths, okay, they vote with their pockets. Trust me on that. We all vote with our pockets because we all hate to pay more tax to finance systems. Then there is consensus now among all the people who involved in healthcare economics or healthcare funding or whatever it is, that providing universal healthcare, poorly, meanly funded by the taxpayer is a new option and untenable. And we have to think out of the box, and Jean-Luc have touched on some of this. Now, if you look at all the healthcare provision in different countries, from Australia to Canada, there haven't been one single model which we say, this is good, this is ideal, let us replicate it everywhere. And as we go on, we will see what the difference which exists with different systems, which make it impossible to have what we call the ideal system we can replicate. Thank you. Right, the global overview of healthcare fund, organizational structure, and the risk governance, and all the rest of it. Can I go to the next one, please? My talk to you today really will be interested about funding, organizational structure, and the area of coverage. Why I'm really looking for organizational structure mainly? Because organization, hence the government funding the great chunk of the healthcare. So they have their rules, they have their process of control, they have their organizational structure, which is different from one country to another, by the way. Therefore, it is important, if you're talking about the fund, you talk about the mechanism which affect and control that fund. And then what the area of coverage. what exactly I'm paying this money for. What does it cover? We will be talking really in general about, I took 4 or 5 examples here: Australia, Canada, Denmark, England, and I have few slides to share with you near the end about the Middle East. Sorry, I lost my cue here for a minute. Okay. Now, this looks like a big slide, but it's really from the country of OECD. And that's what we spend, or what these 40 countries spend as proportion of their GDP. You find that United States spend about 17.7% of their GDP. 45% of that come from federal and tax, and the rest is really private care. That followed by Holland, Germany, but the important thing, you find that about more than 22 countries spend more than 9% of their GDP on healthcare. If you take the main spending, which is the red line there, you find that the average main for the developed countries spending on healthcare about 9.3% of their GDP. Out of this 9.3%, 10% is spent on capital and infrastructure and equipment and so on and so forth, and the rest, 90% of that, is spent on what we call operational cost. That's the day-to-day service and how we pay for it. And if you look at the 90% of that, and this is really a crucial point, healthcare service is high-skilled, labor-intensive. There is no ways around that, okay? You really need them in quality and in quantity. And out of the 90% we spend in healthcare, or the developing countries spend in healthcare, you will find that the pay rule, what we pay for nurses, doctors, blah, 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 and the technicians and the rest of it, is between 53 to 60% of the money. The biggest people who are paid are the doctors, and I think earlier, the earlier speaker spoke about the importance of really proper funding of doctors. It is crucial that doctors and healthcare workers should be funded appropriately to do a good job. Now, this slide really interests me greatly. And the reason it interests me greatly, because it basically, you remember I said number one in the golden rule you're judging the system is the accessibility of the system. So when we drafted the accessibility of the system, how easy for you to get the service, how easy is you to access the system against the spending, you will find that USA, Netherlands, France, and Australia, and Germany, 15% of the population, they said, at one stage or another, we have difficulty accessing the system. And you're talking about, these are the biggest spenders, these are the top spender in healthcare. I take my hat for the NHS in United Kingdom, England, because only 4% said they have difficulty accessing the system. So thank you. Right. This is a complicated and busy table. But Jean-Luc spoke about, Luca have spoke about productivity. And productivity is a very important issue. And I want really to spend a minute or two talking about physician productivity. Hence, they are the highest paid in the system, and they are the most costly human resource in the system. We really need to have higher productivity output, and that will save a lot of money for the system. So what we do, we take the number of practicing physicians to the number of visits by the population to the number of outcome and take out of that really the return for the same issue and treat the emergency visit as a new visit. Is a very complicated formula by which you can judge the productivity of physicians. And when we looked at that, we find that Japan, with 2.2 physicians to every 1,000 of the population, have the best productivity, and they scored about 57 points on the scale. United States, with all the amount spent, 2.7 trillion, you have to remember that 2.7 trillion is spent on healthcare in the United States. Their productivity, index productivity level was 16 points on the scale. Most of the European countries lie between 2024, and Norway is the worst. Norway productivity stands at 10 points on the scale. It is interesting really that if you look at China, China is the second richest world in the country currently, and it just come after United States, and a lot of people say it may bypass the United States. It spends only 5.3% on its health care system of its GDP, and basically that's about 0.6 trillion or $600 billion. So for China to catch up with the rest of Europe and the United States, they have a lot of spending to do. Now, country profile. The healthcare service in Australia, like most of other countries, is set by Act of Parliament. So you have the Parliament and the federal government, which is in charge of policy making, funding, and they do the funds through a special vehicle called Medicare. And basically Medicare distribute the money on the states and the territories. So it's creating a reasonable degree of autonomy for every state to create its priorities. Skip. Right. In Australia, the government really fund about 85% through taxation, and some other comes through local taxation. 15% is covered through additional private insurance, and these which cover exceptional service like dentists, pharmaceuticals, hearing aids, eye, visual aids, and so on. 45% of the Australian have an additional policy insurance cover for that, and the rest they over the counter. But can I just use the next slide? Okay, before I said that, and you will find that as a common theme in all the developing countries, the overall funding if you take the average, about 70% come from government, from 70 to 90. And the rest is funded through either compulsory insurance, as you have in Germany, or through voluntary insurance, or out of pocket, as most of the people do in the United Kingdom for prescriptions. Australia have a population of 27.8 million, roughly spend 9.7 of its GDP. Their spending per capita is about 3,997, about $4,000 per person or per capita. What that means, what the total number, Australians spend 111 billion pounds on their health care. 20 billion come out of pocket. I need to talk a little bit about out of pocket. In the developed country, we have developed something called safety net. And the safety net, basically, it operates so you don't have to pay the 30%. And the government pay 100%. In most systems, the safety net is free for the unemployed, for the pensioners, and for all sorts of people who are afloat. But it means tested. And some countries like Denmark and Germany and even Canada define certain limit of 11, that your income should be under $11,000 per year before we can get you into the safety net. This is really the number of doctors who are doing the service. In Australia, 25,000 GP and 27 specialists. Yeah, we'll just run it. We'll go to the next one. Is that Canada?
Yeah.
Yeah.
Can I say, Magdi, you've got about 5 minutes?
Okay. All right, can you just go to the spending? No, you must. Canada 35 spend about 11% of the GDP. The total they spend about 160 billion. Okay, keep going. Let's go to the Middle East before I reach the conclusion. Okay. The Middle East, you must visit. Yeah. I'm looking at the Middle East, and when you look at the Middle East, Israel spent about 7.8 of its GDP, and their spending per capita is 1.53. Cuba is a very interesting example, because actually it spent 7.6% of their income, and that's about $310 per capita. And I go to the next one. And that's Morocco and Syria. But so the Moroccans spend about $66 per year per capita. Syria, before, well, I think a few years ago, used to spend $122 per capita. Egypt. I'm not sure about the 1%, so I'm sure some people here will be able to correct me, because I couldn't find it. But what's interesting, that the Egyptians spend about $56 per capita in healthcare service. Only 27% of that comes from the government funding. Right, let's go. Can I go to the computer? The next one. Okay. I don't have a prescription really to how to provide healthcare service because one, I will be a multi-billionaire, and two, I will win the Nobel Prize because nobody have it really. So if we want the health service to continue, we have to find effective and innovative way to fund it. And Jean-Luc can have touched it in one or two. I only have two things to add. I am a big advocate of the private-public healthcare scheme because, trust me, we need to get the private health, the private investors, to invest and to invest heavily in the public health, not really in private health. And public-private schemes, if they done the right way, and they are very effective means of funding the healthcare system. The second thing, which may be controversial, is to issue what I call healthcare bond. And if healthcare bond is backed by the government and the assets, it will be attractive to a lot of investors. For God's sake, people putting their money now and getting 0.5%. So if you make that a 2% or 3% in a government bond, people will invest heavily in the healthcare service. I didn't think that a prescription. Some people will argue against that because they've said it will increase the public debt. But it will reduce the spending on healthcare, so it balances itself at the end. Thank you very much.